Let us now learn about anterior triangle of neck. Anterior triangle of neck is a triangular area on each side of neck in front of sternocleidomastoid. Boundaries of anterior triangle. Anteriorly, anterior median line of neck extending from symphysis menti to suprasternal notch. Posteriorly, anterior border of sternocleidomastoid. Base, it is directed upwards. It is formed by lower border of body of the mandible and the line joining the angle of the mandible to the mastoid process. Apex, it is directed downwards. It is formed by the meeting point of anterior median line of the neck and anterior border of the sternocleidomastoid at suprasternal notch. Roof of the anterior triangle. From superficial to deep, it is formed by skin, superficial fascia, investing layer of deep cervical fascia. Subdivisions of anterior triangle. Anterior triangle is further subdivided into 3.5 triangles by anterior and posterior belly of digastric muscle and superior belly of omohyoid. In some books, they have mentioned only anterior belly of the digastric along with the superior belly of the omohyoid divides the anterior triangle. The 3.5 triangles are half submental triangle and remaining 3 are digastric triangle, carotid triangle and muscular triangle. Next, let's see submental triangle. Submental triangle is a median triangle of the neck below the chin and above the hyoid bone. Boundaries of submental triangle. On each side, anterior belly of digastric. Apex, it is directed upwards and it is formed by the lower border of chin or symphysis menti. Base, it is directed downwards. It is formed by the body of hyoid bone. Floor, it is formed by mylohyoid muscle and median fibrous raphe. Two mylohyoid muscles meet at median fibrous raphe. Median fibrous raphe extends from symphysis menti to the body of hyoid bone. Roof is formed by investing layer of deep cervical fascia. Roof of all the subdivisions of anterior triangle is formed by investing layer of deep cervical fascia. Contents of the submental triangle are submental lymph nodes, submental veins, anterior jugular vein. Submental veins, they join to form anterior jugular vein. Submental lymph nodes, they are 3 to 4 in number. They are situated in superficial fascia between anterior bellies of digastric. Digastric triangle, it is also called submandibular triangle as it is located below the base of the mandible. Boundaries of digastric triangle. Antero-inferiorly, anterior belly of digastric. Posterior-inferiorly, posterior belly of digastric supplemented by stylohyoid muscle. Base, you can see the base is directed upwards. It is formed by lower border of body of the mandible and the line joining the angle of the mandible to the mastoid process. Apex, it is formed by intermediate tendon of digastric muscle. Floor, it is formed by three muscles from anterior to posterior, mylohyoid, hyoglossus, middle constrictor of pharynx. Roof, it is formed by investing layer of deep cervical fascia. Contents of the digastric triangle. The digastric triangle is divided into anterior part and posterior part by stylomandibular ligament. Contents in the anterior part of the triangle are superficial part of the submandibular gland, mylohyoid nerves and vessels, submental artery, facial vein, submandibular lymph nodes, and hypoglossal nerve. Contents in the posterior part of the triangle are superficial structures, lower part of parotid gland, external carotid artery, deep structures, styloid process, styloglossus, stylopharyngeus, glossopharyngeal nerve, carotid sheath and its contents. Carotid triangle. Carotid triangle contains all three carotid arteries. Hence it is called carotid triangle. Boundaries of carotid triangle. Antero-superiorly posterior belly of digastric. Antero-inferiorly superior belly of omohyoid. This is anterior side, this is superior, this is inferior. Antero superiorly, posterior belly of digastric. Antero inferiorly, superior belly of omohyoid. Posteriorly, anterior border of sternocleidomastoid. Floor is formed by four muscles: hyoglossus, thyroid, middle constrictor of pharynx, inferior constrictor of pharynx. Roof, it is formed by investing layer of deep cervical fascia. Contents of the carotid triangle are: first, arteries. Carotid arteries. All three carotid arteries. Common carotid artery, internal carotid artery, external carotid artery and its five branches. The five branches of external carotid artery present in the carotid triangle are: superior thyroid artery, lingual artery, facial artery, occipital artery, ascending pharyngeal artery. Veins: internal jugular vein and its tributaries. Nerves: 10, 11, 12 cranial nerves. 10th cranial nerve, that is vagus nerve. Vagus nerve. 11th cranial nerve, spinal accessory nerve. 12th cranial nerve, hypoglossal nerve. So 10, 11, 12 cranial nerves. Ansa cervicalis, cervical part of the sympathetic chain, carotid body, carotid sinus, carotid sheath, deep cervical lymph nodes. Ansa cervicalis is embedded in the anterior wall of carotid sheath. Cervical part of the sympathetic chain is present behind the carotid sheath. Carotid sheath is present around common carotid artery, vagus nerve, internal jugular vein. Muscular triangle. Boundaries of muscular triangle. Anteriorly, anterior median line of neck extending from hyoid bone to suprasternal notch. Posterior superiorly, see this is anterior side. Next posteriorly. Posteriorly we have two muscles. So posterior superiorly, superior belly of omohyoid. Posterior inferiorly, anterior border of sternocleidomastoid. Floor, it is formed by pretracheal fascia, thyroid cartilage, cricoid cartilage and trachea. Roof, it is formed by investing layer of deep cervical fascia. Contents: sternohyoid, sternothyroid, thyrohyoid. Sternohyoid extends from posterior surface of the manubrium sterni to hyoid bone. Sternothyroid extends from posterior surface of manubrium sterni to oblique line on the lamina of the thyroid cartilage. Thyrohyoid extends from oblique line on the lamina of the thyroid cartilage to hyoid bone. So the contents are sternohyoid, sternothyroid, thyrohyoid.